Welcome and good afternoon. It is awesome to have so many participants interested in our new forensic treatment program. We do see some additional people signing in, so just want to kind of do some quick overview of what we are going to try to accomplish here today. I'm very excited because we have a name for our new forensic treatment program. As you can see on our slideshow, we are calling our program Recovery Works because we know that it does. We know treatment works and we know that recovery is a reality, and we're very excited to offer a new forensic treatment program for our state. You are listening to Sarah Kozad. I am the Assistant Deputy Director of Adult Services, and I also have with me Angie Borman.
Good afternoon.
We are going to talk to you today about this new program, specifically the application process for becoming a designated provider. We're going to talk in some detail about the fund, and hopefully this will be some refresher information for folks, as I believe, hopefully, you have already seen some communications from us. I do want to take this opportunity to just let people know I have heard some feedback about some of my communications not getting to everybody that it should. So I just want to ask that if you are a certified provider with DMHA, and you know of other certified providers who aren't receiving our communication, if you would be so kind as to let them know to contact me, again, Sarah Kozad, at fssa.in.gov, so that I can ensure that we have the correct contact information in our system. I've also been able to work with some IT folks at various sites to help with blocking or unblocking our spam filter. So just again, if you know that people should be getting this information and they are not, do pass along my email and let them know to contact me directly. I'm happy to answer any questions and to try and troubleshoot. And we've got the email up on the chat bar. So without further ado, again, welcome. And today we're going to spend some time talking about Recovery Works. So great. Just want to remind everybody why this is so important, why the legislation this year has put some money in our fund so that we can start to serve a population that has been vastly underserved. We know nationally that there are 650,000 people released from prisons annually, and Indiana alone releases 18,000 people from the Department of Correction. This doesn't even take into consideration folks that are currently being diverted and potentially being released from jails in the local counties. The criminal justice system is the largest referral source to substance abuse treatment, and so we know that this is going to be a large pool of referrals. We did receive some estimates that 6,500 level 5 and 6 felonies will be diverted from the Department of Corrections into the community. And so we do have a large number of people who are potentially eligible to work with our Recovery Works program. So I do want you to keep in mind that you at the local level are going to be the best possible source to figure out what those numbers are going to look like. And so we'll be encouraging you to speak with the local criminal justice providers in your area, and we've been encouraging them to speak with you as well, to start having conversations about what that referral number may look like in your area. So I do just want to remind you that we at the state we understand that this could be a very large number, and so we're looking to you at the local level to kind of have those conversations so that you can determine what the impact will be on your area. The Mental Health and Addiction Forensic Treatment Fund did come out of legislation this year. House Enrolled Act 1006 established funds specifically to support services for those without insurance coverage who are involved in the criminal justice system. And so I have here that you'll see the eligibility checklist. I did attach that document to the notice for this meeting, but we will also go over that in some detail here in a second. The other part of this Forensic Treatment Fund also established the Justice Reinvestment Advisory Council. I do want to remind people that we at the Division of Mental Health and Addictions have been working in conjunction with the Department of Corrections, as well as various various people involved in the criminal justice system, including community corrections, prosecuting attorneys, defense attorneys. We are working with probation officers, and so there are a lot of people that sit at the table for Justice Reinvestment Advisory Council who are advising this process. And so I am excited to say that this is a very collaborative effort as we develop our program. Recovery Works has two funding priorities that came out of 1006. That is for pre-incarceration diversion services as well as post-incarceration re-entry services. So we are talking about people who are in the community either because they've been diverted or because they are re-entering. I spoke to the eligibility criteria, and so this is a very simple checklist where you will be kind of verifying for the criminal justice provider that these things are true. It will be the criminal justice provider's responsibility to do the initial eligibility screening. We will be asking our designated treatment providers to just verify that the information is correct. And so what we're looking at is the individual a resident of Indiana? And if they are, then they are eligible. Is the individual at least 18 years old? Again, yes, they are eligible. Is the individual a member of a household with an annual income not exceeding 200% of the federal income poverty level? So once again, if they can verify this, then they are eligible. Finally, has this individual entered the criminal justice system as a felon, or do they have a prior felony conviction at some point in their life? And so if that is a yes, they are currently facing a felony, or they have a prior felony conviction, and maybe this is a current misdemeanor charge, but they are currently involved in the criminal justice system, then they can be eligible for treatment vouchers. This is hopefully something that you guys have seen as well, but I do want to go through our process flow, just how the high-level collaboration is going to work. And so you'll see at the top this eligibility screening. We are going to have our criminal justice providers doing that initial eligibility screening and completing an initial referral form. As you can see, we can have referrals either from the pre-conviction diversion, post-conviction diversion side, as well as post-incarceration reentry side. So they're leaving their incarceration setting and reentering the community. So referrals will come from the criminal justice providers, and the referral will be for an initial assessment. And so we'll talk in some detail about what the requirements will be for that. Service recommendations then will be provided by the treatment provider who did the assessment. We will talk in some detail about what that form will look like and how you will communicate. But the treatment plan will be taking into consideration all of the needs, not just necessarily the mental health and addictions, but those wraparound supportive needs as well. And so we'll be talking about a comprehensive list of services. So the treatment plan with the corresponding treatment service vouchers will be entered into our WITS system, and we will talk about that as well in some more detail at a later date. But finally, the treatment provider and the referring agency are going to then collaborate on program progress and participation in the mental health and addiction forensic treatment services. So again, this is a very collaborative approach that we are encouraging at the local level, some discussions and some conversations, so that you guys at the local level can decide what's going to work best for your community. When we talk about Recovery Works and the reimbursement process, what this is not is, it's not a grant. We are not doing a grant, we're doing a voucher reimbursement system for the services. So voucher reimbursement, I do want to qualify this. We are not going to be paying for services that can be covered by other payer sources. So if there is a service and a payer source, we're looking to that payer source first. However, if services are not covered by that initial payer source, there's a likelihood that the voucher could help fill in the gap for services that maybe might not be covered, such as certain Medicaid services. And so again, we'll talk about that in some more detail here. The just kind of brief list you have in front of you, a regular insurance policy of accident or sickness insurance, an HMO. We have some waiver programs, BPHC and AMHH, that are currently going on. And so if they're covered by that, but there are some services that maybe wouldn't be, you could have some supplemental vouchers. The Medicaid program has an asterisk by it. We will talk about that on our next slide, and also if there's any federal Medicare program or other federal assistance program. This is basically a payer of last resort. So with Medicaid services, if the service is covered by Medicaid, the billing agency may qualify for a reduced rate voucher that's equivalent to the agency's Medicaid match. And so what we're trying to do is incentivize those providers who do have the ability to bill Medicaid, that we will pay the match so that that doesn't come out of your funds. And so we will be able to claim for and reimburse services at that match dollar amount. When we talk about the services, I did provide a list of services and the location in which they can be provided in the attachment that came with the meeting announcement, but we do want to just give you another list of those services. I do want to specify that the details of what the service encompasses and what providers are able and eligible to provide those services, these will be listed in detail in the provider manual. But what we have done is we have just, rather than reinventing the wheel, we're taking our service definitions from Medicaid standards, as so many people are already familiar with those, and we can base those off of those same standards. So if you're curious and interested in this ahead of time before the manual, before that manual is released, you can look at the MRO standards and pretty closely match those up. And so we will be releasing the manual in the near future. It is currently in review. So rather than going through all of the details of the services at this point, again, if anyone has any questions, you can use the chat window. We'll do some question and answer at the end. Let's talk about the application process and who is eligible to become a designated agency. We've discussed that the statute set into place who's able to provide these services. And by statute, it is for licensed and certified DMHA agencies. And so that is why you are all invited to this webinar today, is because you are listed in our licensed and certified DMHA agencies. Again, if you know of anybody who's not getting this information and you think they should be, please do connect them with me, and I will ensure that we get them the information. This webinar also is being recorded, so we will have this posted for future viewing, if anybody misses it today. So the licensed and certified DMHA agencies are eligible to apply to become designated agencies. They will then be able to access treatment funds via a voucher system. We are currently going to be using the WITS system. It is an acronym because we love our acronyms. WITS is the Web Infrastructure Treatment Services, and we will be doing training on WITS if you've not been familiar with it or you haven't used the system prior. But this is the voucher system. And it is truly going to be as simple as you provide the service and you will be able to claim for a voucher to pay you and reimburse you for that service. We are looking for all of you today to assess your capacity. You're going to be wondering, should I apply for this? Should we become a designated provider? And we hope that you all do, because we are very excited about the opportunities to build some really focused and wraparound services in each of our communities. So what we're asking you to do is, as an agency, assess the capacity for providing these services and accepting the referrals, which is another reason why I'm asking that people talk with your criminal justice providers in your area, talk with the community corrections people and the sheriffs, and get with your probation officers in your area and start having those conversations, because that will be able to inform your decision-making process of whether or not you have the capacity to meet the needs. Furthermore, we have individual providers who need to assess the training needs and whether or not the individual providers want to do this service. So once the agency becomes a designated agency, providers will individually become designated providers. And so individuals providing service must meet some training and competency requirements that we've established and that have also been established by the statute. So with that, the individual providers within designated agencies can become designated providers of the recovery work services. So in order to become a designated provider for Recovery Works, individuals will have basic educational and or license requirements, and then we will have some additional training requirements. So once again, I'm modeling this after Medicaid standards, and so if you're looking at rule and Medicaid rule, you can look and find these definitions, but we will again have these very clearly defined in our manual. But based on Indiana Medicaid billing standards, providers must qualify within one of the following designations. So even if you're not a Medicaid provider and you're not billing Medicaid, we're still going with these same standards, as that way it will make it equitable across the board. So you're either going to be a licensed professional, a qualified behavioral health provider, or an other behavioral health provider. And we'll go into some detail about each of those here. Licensed professional. So if you're a licensed professional, a psychiatrist or a physician, or an HSPP, or again, you're a licensed clinical social worker, mental health counselor, marriage and family therapist, or a licensed clinical addiction counselor. And we have the Indiana code that qualifies who can provide those services. So if you're a licensed professional, you as an individual provider can be eligible. If you're a qualified behavioral health provider, so this pretty much says an individual who's had at least 2 years of clinical experience treating persons with mental illness under the supervision of a licensed professional. You have a master's degree and you're working toward your licensure. You are qualified behavioral health providers who can provide the services. We also have other behavioral health providers, and these are individuals with an associate or a bachelor's degree or equivalent behavioral health experience that meet minimum competency standards set forth by the provider agency, so the designated agency. And again, supervised by a licensed professional or a QBHP. And so these folks are your people who are going to provide things like skills training services and case management services and maybe employment services, just as a sample set. In addition, other behavioral health providers, a licensed addiction counselor, so an LAC, as defined under that Indiana code, who is supervised by a licensed professional, is also considered an other behavioral health provider. Furthermore, we do have some services that are in our service list where providers for those types of services, recovery support services, example, that if you have a Memorandum of Understanding with a designated Recovery Works agency to provide those specialized services, more than likely you're going to qualify. So if you qualify already to provide these services at your agency, the likelihood is that you're going to qualify under our Recovery Works program. But if there are any specific questions, we can talk through those. So other than your basic licensure and credentialing requirements, we additionally have some training requirements. And so the designated provider must be willing to complete the required training prior to June 30th of 2016. And so that is the end of the state fiscal year. Before we move into year 2 of funding, we're saying that anybody who wants to get started and gets providing services, as long as you agree to complete the training prior to that June 30th date, you can claim for vouchers up until then. However, if you want to continue providing services beyond that date, the training must happen. So we're talking about things that more than likely you guys are already doing, but we do want to ensure that there is some type of personal safety or nonviolent crisis intervention training, and that you can provide evidence that you participated. We also are going to have some specific requirements related to motivational interviewing, and those will be forthcoming, but we will be offering training opportunities, and we will be covering the cost of that more than likely. So we do understand that there will be a time cost. However, we're looking to cover the cost of the training. There will also be some online trainings, recovery model focused training, as well as working with the justice involved. There's some really unique requirements for working with this population to know specifics about criminogenic thinking and the thinking errors that often result in these persons having recidivism. Finally, you'll see here ANSA. And so for providers at our CMHCs, this is nothing new. You guys do ANSAs every day. For those of you who do not currently do ANSAs, this is just one of those additional requirements that we're giving people until June 30th to get certified with ANSA and be able to begin that process. Designated provider expectations. So once you have become a designated agency and you've chosen the providers within your agency who are going to be the ones providing the service, we want you to understand that there are going to be some specific expectations for participation in the program. First off, you are willing, by saying that you are now applying to become a designated forensic treatment provider, to accept referrals from criminal justice providers, and to contact the referred participant within 2 business days in order to schedule an assessment. Now, for providers who are attempting to contact that person within 2 business days, however, they cannot reach them for the variety of reasons we all know to be true, we are just asking that you communicate with your criminal justice provider, that if you can reach them, you're documenting that outreach, and that you are offering them an appointment for an assessment within 5 business days of the referral. I do want to remind you, though, that we have some requirements on the criminal justice provider side, and that referring provider agrees to give you required documentation with the referral, so that they have provided you with information to inform and facilitate your assessment. What we don't want you to do is see this person for a biopsychosocial assessment without the supporting evidence of why they're being referred to the program. And so we are asking the criminal justice providers to give us some legal documentation, some court paperwork, as well as an assessment of risk that they do called an IRAS. And so the treatment provider will not be expected to assess that person who's being referred until the documentation has been received. So as I have stated, you're going to contact them within 2 business days to schedule that assessment. You're going to offer an appointment within 5 business days of the referral. And as long as you've done your due diligence to do that, then you're within the requirements of the program expectations. Additional expectations, once you have scheduled the appointment or allowed open access for an intake assessment or a biopsychosocial, you will obtain all necessary participant consent and release of information forms so that you can then communicate with the criminal justice provider. You will complete a biopsychosocial assessment, including an integrated substance use assessment. We just want to ensure that everybody understands we're assessing both mental health and substance use disorder needs within that initial assessment. Also, as I mentioned, there will be an adult needs and strengths assessment completed, the ANSA. I have that asterisk there because remember, if you are not already ANSA certified, we will give you that window of time to get that training and that certification completed. And so all designated agencies, if they're not currently ANSA certified, will be working toward that certification if they are applying. Additional expectations, we will be asking the provider to guide this participant through the development of what we're calling an individualized recovery plan. And then you'll share that with the criminal justice provider. Now, we understand that each agency and organization has treatment plans that you already utilize, and so I don't want you to think that you're duplicating services. This individualized recovery plan is a very simplistic form that you will complete with the participant to ensure that everybody's on the same page related to what services are going to meet the needs of this person. Not everybody is going to need all of the same package of services, and so this is where you're communicating to the criminal justice provider, this is what we believe is going to be effective treatment for this person. We also expect that you will engage the participant. Engagement is key, and this is a population that is difficult to engage, and so again, some very specific motivational interviewing techniques will be required. But we're hoping that you will be actively engaging that participant, collaborating with all members of the treatment team, both in your setting as well as anyone that you've contracted with to provide other services, and most importantly, keeping that criminal justice provider involved at all times so that we do that comprehensive wraparound and collaborative support. So communication is going to be expected, frequent communication, but what I will say is we are not setting standards for what that communication looks like in the terms of reports, such as probation often asks for reports monthly. What we're looking for is, again, the community, local level, are going to be talking with each other about what's going to work best for your relationship and your partnership. So if reports monthly work well, that's great. If you're going to actually go to the site and check in once a week, we really want that to be up to the local level determination. Continued expectations. Once you've completed that individualized recovery plan, we expect that you'll provide the services based on that individualized recovery plan. And if those services change at any point, that you will update the individualized recovery plan and provide that to the criminal justice provider. If you're unable to provide any of the recommended services that are listed in the IRP, we're asking that you partner with another agency, and that's going to be part of the application. If you are not at your agency providing the services that are available to the folks that are receiving the vouchers, then we're going to be asking you to get with people in your community who do provide that service so that we can have a nice comprehensive array of services to support the person being referred. We will ask that you submit your billing accordingly. So you provide the service and then you will bill for that in the voucher system. Again, training for that will be forthcoming. We will ask that you maintain an ongoing record of all contact and attempted contacts. So we are not asking you to do anything different than what you already do. So if you have an electronic record and that is already a part of your process, that's fantastic. If you're still doing paper charts, we understand. We just want to know that you are keeping record of all contacts and all services, and that if we and when we audit, you will be able to demonstrate that yes, we were billing for these services and they were completed on these dates. So speaking of, if your agency does not provide one of the services, we're talking about local communities developing memorandums of understanding, so MOUs, that say we're partnering with you because you do a great job at this service and we're really focused on these services, and so we're going to partner and we're going to refer to one another. So for example, if XYZ Safe Housing is really focused on their transitional housing and that's what they do, they can offer transitional housing for all of ABC recovery counseling participants. So we again are going to be asking that if you don't provide the service at your agency or organization directly, that you'll be having conversations with people who can provide those services. Best practices. What we're talking about when we're discussing treatment is that these treatment plans and all of the approaches must be individualized. What we don't want is for the criminal justice provider to refer for this many sessions of IOT for this long. We're looking at the treatment provider as being the subject matter expert who can say, this is our recommendation for services. We don't need cookie cutter treatment. We want things that are individualized for this unique individual. So you'll do the assessment, the biopsychosocial assessment. You'll do your individualized recovery plan with the person who's being referred. So treatment planning, linkage to services, these are all very uniquely wrapping around that one individual. So the length of time, the types of programming, the funding resources, this is all going to be looked at very individualized. So we don't want our treatment providers to feel the pressure that you must enroll in this type of program. We know what's efficacious, we know what evidence-based practices are out there, and we're looking at the treatment providers to be the subject matter experts on what's going to be the best approach, while collaborating with that criminal justice provider on what they're looking for from their supervision side. So this is very critical that there's going to be some consistent collaboration with the community supervision side of things as we are treatment providers. So the Recovery Works Fund, what is it and what is it not? So it is a funding source for treatment for those who are involved in the criminal justice system. This is a supplement to community supervision strategies that will decrease recidivism. This is also access to individualized treatment and recovery services. It is not a diversion or reentry program itself, so you're working in conjunction with those. It is also not a standalone solution to community placement for forensic populations. Again, this is not supervision, this is treatment. And finally, it is not a punitive measure as discipline for criminal acts. We are not sending people to treatment as punishment. We are sending people to treatment so they can focus on their recovery and find alternative pathways toward that recovery. Finally, we'll get to the application. So the application itself is very simplistic. The majority of the work is done up front while you're having those conversations with the local providers and criminal justice people in your area, and you're determining whether or not you have the capacity to apply. The application itself is a 2-page form, front and back. It has very basic information regarding your agency. And then it has a checklist for the recovery work services that are offered. So again, if you don't provide that service at your agency or organization, we're asking for information about who you will be partnering with to cover that service. Because what we need to ensure is that in each community, in each location, at the county level, whatever level we're looking at the local level, you guys are partnering to ensure we have a vast array of services. And then a list of the providers who are going to apply. So this is where, again, the agency becomes a designated agency and the individual service provider becomes a designated provider. And so we have space for numerous providers, and that'll, again, be your decision at your local agency who's going to be providing the service. We have a quick little screenshot for you. I know it's very small, but we just wanted to show you that we really do mean that this is quite simple. You'll be able to put in the organization information, who the contact is, who we should be speaking with, basic address and county of service and those pieces. And then there's a list of the services. You can see just that kind of is cut off, but what services are you providing? And if you're not providing it, who will be providing it? And then lastly, the individual providers. We have this section on here I just want to kind of point out who's going to access WITS. And so just briefly want to remind people that there are ways that different agencies will do it. Some people might be providing the service directly and then entering and claiming for it themselves. There might be other agencies who decide we're going to do our billing department and they're going to be the only ones that enter services. And so we just want you to think who's going to need to access our voucher system, because those are the folks who are going to need to go through our training on accessing the voucher system. So application review process. Once we receive your application, it will be reviewed by our Recovery Works administrative team. It will also then be approved by our DMHA certifications team to verify and validate that, yes, you are in fact DMHA certified. We will then send you an official approval letter with the agency agreement. Agency agreement, again, our legal form that says, yes, we agree to do all of these things that you told us we were going to do. And then once you have been given your approval, we will do an online manual training. We will offer you, just as this webinar is going to be recorded and posted for later viewing, we will do the same thing for our online manual training. And then we will also have a DARMA/WITS training. And so this is some state reporting requirements that we have. So for those of you who have never heard DARMA before, this is just a state survey of demographics and programs that we require so we know what population we're serving and so we can report where the funds are going. And so we will train you, if you've not accessed DARMA before, on how to access DARMA and how to utilize WITS. And WITS, again, is the voucher management system. So there will be some very specific trainings on those. And then finally, once you've been trained on how to utilize the system and what the manual details are, then you're ready to provide services to participants. So we have just kind of the overview of what the next steps will be. We are opening applications as of the end of this webinar. We will post the application for those who have attended, and there is no end date. You can apply as long as we have funds. And so what we're asking is the sooner that you apply, the sooner that we can get things ramped up, and the sooner we can serve people in your community. I know that the criminal justice providers out there are really excited about this opportunity, and they're looking for providers to refer to. So we're going to host our first manual training on October 26th in hopes that that gives people enough time to determine if this is going to be the right fit for them, and that you do want to apply, so that we can get a nice workforce out there to provide these services. So again, October 26th is our date for our manual training, which we will then do ongoing. And then we're going to have our DARMA and our WITS training at a date to be determined. We are currently waiting on this system to be built. It's in progress. And so that is where our tentative date of November 3rd comes in. We are tentatively saying that this is our date because it is all dependent upon the voucher system being up and running. We are working very diligently on this, and we really do have our sights set on November 3rd as our rollout date. So with that, we've gone through all of the details, and we do have questions in our chat box. And so we're just going to kind of go through and answer some of those questions as we have a little over 20 minutes left. Okay, so the first one we have from Porter Stark. Do we have to prove income, or can we have declared income? We are accepting declared income. Okay. Another question from Vicki. Initial screening done by probation officers. So the initial screening for eligibility is going to be done by probation officers or any of the other entities that are on the criminal justice side. So they are going to make the referral form a complete fact with the initial screening of eligibility. And then we're just asking that you as providers verify this information to be accurate.
So hey guys, this is Angie. I'm gonna jump in and help kind of clear up some other questions that kind of jumped in. There were some questions from the crowd about ATR and how this is similar with ATR. So this program, the process of how things are done in WITS is very similar with the voucher program. So the initial eligibility screening will be done with the criminal justice providers, and then participants will be referred to you as the treatment providers, and you all will administer the services and voucher. You will be the coordinator of services for the participant. And yes, the billing is going to be similar to ATR, but all done with you as the treatment provider and the same person. So that's how it's different from ATR. There's no, I've just completely lost the,
Duplication. Is that what we're talking about?
No, I just lost the ATR word that I was looking for. I'm sure one of you will pop up and tell me. RC, there's no RC any longer. And so that person has kind of been eliminated. You guys as the treatment provider will do that an assessment, and you will help do the voucher for the services and be that case manager all in one person. So then the next question was, you will provide the service and then vouch, do the voucher. You may use your own biopsychosocial assessment instrument. We're not mandating what that is. The following one was transportation assistance. So that would be, you could purchase a group of bus passes and give those out. That would be transportation assistance. You could help pay for a cab fare and get reimbursed for that cab fare. So, might have missed it. Will Dharma and WITS connect with each other? Yes, that's a beautiful question, Carrie. For the first time ever, we will have Dharma and WITS connect, which is a beautiful thing. So that's part of what the holdup is and why the tentative November 3rd is, because you will enter your client into Dharma, and then instead of having to have a duplicate entrance, your participant will automatically be entered into WITS. And so for the first time ever, Dharma and WITS will talk to each other, and it's a very exciting, we're so pumped about that. So eventually the ANSA information, all of that stuff will go together. So it's really exciting. So Mark, to answer your question about the voucher amount, we have not determined, we haven't settled on a number. We can share with you
Oh, wait.
Perhaps.
Not about the cap. So I think has the voucher amount for various services been determined? Yes, we have a billing rate for all of the services, and that will be detailed in the manual. As far as I think what Angie was speaking to is we're looking at a cap per person so that we can serve a vast amount of people, but we're also ensuring that we have quality, not just quantity. So we're looking at a cap for dollars that will follow the person with a prior authorization process. But yes, the services have been determined what those are going to reimburse at, and that'll be a part of the manual. But we did model it very closely after Medicaid standards and payers. Lots of questions.
We will send after this webinar, we're going to run back upstairs to our office, and we will send out the application by the end of the day today. Mm-hmm. So everybody that was on today's email list to attend this webinar will get a copy of the application. So you'll get it that way. By the end of this week, first of next week, we hope to have a web page set up where you can access the application that way as well. Sorry, you guys, these questions are coming in so fast.
They move.
Application. Mm-hmm. Next one was, okay, let me explain the referral process one more time. Mm-hmm. Let's go through this again. Okay, so an initial participant is in the criminal justice system. That individual is, I'm going to highlight this question really quick so I don't lose my place. So that individual is determined to be eligible with the criminal justice provider. So they meet the 4 eligibility criteria. That individual sits down with their, let's just say, probation officer, as using an example today. That probation officer is going to pull up the website and say, these are your 3 providers in your community that are offering the Recovery Works program. From that participant is going to say, okay, these are my 3 choices. I choose this. And from there, the criminal justice provider is going to send the referral form to that agency. That agency is going to then link it with the criminal justice provider, the treatment provider that is within that agency. So if there's 3 providers within XYZ agency, then one of those providers will get that referral form. That then provider has that number of days to reach out to the participant and take it from there. That provider is then responsible for the biopsychosocial assessment and to take it from there. So we're really pushing our criminal justice providers to do client choice as much as possible versus saying this is where you're going to go, because client choice is important and we all know that. We all know reality as well, that probation officers have their favorites, and we know that. But when we discuss this with the criminal justice providers, we are strongly encouraging that they give clients choices.
Absolutely. Requirements for transportation assistance. So we already kind of did speak to the transportation assistance. We have those defined in the manual, but really we're talking about filling in the gaps. And if transportation is a need that is going to facilitate recovery, then we are looking at providing service for that. So we will, if there are things that we have not stated that we will cover in the manual that are different types of transportation assistance, we are open to feedback, and we are open to kind of additional resources as you guys in your local areas can provide them to us. So next one. Is there a limit on the funds available per person? So again, we are looking at a cap. We've kind of thrown out the $2,500 range for the year, but it's not official yet. We're looking at what we can do and how far we can spread this. As far as a way to prevent a dash for cash, that's a great question. We're going to be releasing the funds incrementally over the quarters. So we do have $10 million for year 1. Some of those funds are going to the infrastructure, but then the rest are going solely to treatment. And so we will be looking at distributing those funds and releasing the amount in increments so that we can continue to assess what areas do we have providers in, where are all the referrals going. This is very much a work in progress that we will be keeping our hands on and our eyes on the entire time. So we will seek feedback ongoing, and then we will make decisions based on that. So the question about batters intervention programs, we are still in the discussion process of whether we will provide vouchers for that. It wasn't specifically outlined in statute, but we also have a little bit of flexibility. And so that's a question that we are taking to the Justice Reinvestment Advisory Council this week. And so we will be able to provide some feedback on that soon. Transitional housing?
Transitional housing, so what's meant by that? So transitional housing is housing that is between, it's housing that's when you're in transition. So there are, in our manual, there are very specific guidelines for what's acceptable housing. And we can share those as those are kind of solidified, if that's helpful for you, Steve, because I'm looking at you for that question specific. So it's not permanent housing, it's not permanent supportive housing, but it's that in-between housing. So it's not shelter housing, but it's specifically transitional housing. So Steve, I'm happy to kind of share with you and give you some specific examples.
We will also take feedback. If there are certain services that you believe would be instrumental in helping somebody achieve recovery, we're willing to hear that feedback.
Porter Stark, as far as getting a preliminary look at the manual, I wish that I could. It's not even at the preliminary look stage. So give us just a few more weeks, not even a few more weeks and it'll be completely done and we'll put it up on the website for you guys.
We currently have legal reviewing it, and so we're at that place where we don't want to release things that would be then inaccurate or not then kind of covered because of legal review. So
we will get ANSA training information for you guys on the website as well. We'll send you a link for where you can get trained for that. And how it's used in the process is it's another adult needs and strengths assessment for you. And the reason why we're using it is because it's a data point that we use for all of our state programs. So it's something that we use for everything.
We want people who have not been familiar with the ANSA to understand that this is it's an assessment tool that can inform your treatment planning. And so basically, in a nutshell, areas that the participant is having functional impairment within each of these areas, that then kind of states, oh, they've hit this number, they've been assessed at this level as having a functional impairment. And so this is something that should be on their treatment plan. We should be addressing those very specific things that are triggered as being areas of need in the ANSA. And so it's just, again, another really useful assessment tool, as each of our biopsychosocial and the IRAS and the ANSA and all of these things, they're tools to utilize to inform the treatment process. Wow, these questions are coming.
I got all of them.
Oh, okay, great.
How many days of detox?
That is a great question. Detox. We are looking at that right now. I believe there was a determination that your basic level of detox, I want to say 3 to 5 days, but that is kind of still up in the air right now. There are some things that we're still trying to figure out. Again, I'll seek recommendations if you have any. Voucher choice for consumers, how's community defined, or local areas? So the question is, how are we defining community or local areas? We really are kind of looking at county. The way that the criminal justice system is set up there by county, and so we know that that will likely be how the referrals are coming, but we are allowing you guys to define it because if you're in this one region according to the criminal justice areas, but you're closer to the county that's next door to them, it might be better off for that participant to provide or to be provided the services in the neighboring county. And so we really are allowing, at the individual level and the local level, you guys to define what that community and local level looks like. What else? Oh, I see. It will be difficult to determine what we provide without the definition. So again, I will state that our definitions are, majority of them come straight from Medicaid manual, and we can try and get the definitions out to you, as the majority of those have been approved. So we can try and shoot that out to you guys.
Okay, so there's this one.
Oh, so is a mental health diagnosis required for eligibility? So we are looking at both mental health and substance use disorder diagnoses. We want everybody to understand that we're looking at that comprehensive model, and so when you're thinking about whether or not you're going to apply to be a provider, we do want you to be thinking about that holistic person approach. And so while you don't have to have a mental health diagnosis, you can have a substance use disorder as your primary. We want to be looking at all those underlying factors, because we do know that people who are involved in the system, it is very unlikely that they have solely a substance use disorder. There's probably some type of personality disorder going on, or there are histories of trauma. We know that percentage of folks who have trauma who are in the criminal justice system is a very, very high rate. And so while we will take substance use disorders as the primary diagnosis, we are expecting that comprehensive approach. Are drug screens covered? That is not something that we are covering in the services. We do believe that is something, if the criminal justice provider wants that, we're looking for I'm trying to think as I talk it through that it could be something that we might want to cover. It's a great question. We will take that to JRAC as well. Thank you for the feedback. Does the target population include both those being discharged from DOC facilities as well as those from county jails? Yes, it does. So if they're re-entering from Department of Corrections or re-entering from the county jails, and they're on some type of community supervision, some type of community diversion program, we can provide vouchers for those folks. And how do vouchers work for subcontracted services? This is a fantastic question.
Do you want me to take it?
Yes, Angie, take it.
Okay, so for vouchers for subcontracted services, so if you used inpatient detox as an example, so I'm going to go with that one. So you provide all of the other services except inpatient detox. So on your application, you're going to say that you're going to mark X for all the other ones, and then you're going to put ABC Detox as your partner agency for the other ones, which means that in WITS, we're going to mark that you provide all of the services. And then when you go to vouch for patient Charlie Brown, you are going to vouch for the inpatient detox. You are going to get paid for the inpatient detox, and then you are going to then pay your subcontractor for the inpatient detox. So we will pay you for the service, and then you pay your subcontractor.
And so that would be the same thing for any of those services that you don't provide.
Yes.
Directly in your setting.
So you will want to make sure that in all of your MOUs and all of your agreements that you have, yes, you will want to do a formal contract with your subcontractors. And in that formal MOU agreement, you'll want to make sure that they understand that it's going to be a 60, 90-day payout before they get paid. So the state pays you 60 days out, so whatever your payout is after we pay you. So you'll want to make sure that that's written in your MOU with your subcontractors. That's it.
All right. The questions have stopped at this point, and we do have 5 more minutes before our scheduled end time. I do see some people typing, so we are willing and able to continue with question and answer. You scroll all the way to the bottom. Okay.
I'm going to write your email and mine too.
Okay. So we're posting both of our email addresses here so that you can contact either of us. Oh, there's no Z there. Thanks. Okay. So the question is, we can both be a contractor and a subcontractor for others then, right? Yes. That's exactly what we're trying to do, is coordinate within the local areas what providers do this and what providers do that, and that you're all working together and having those collaborative wraparound ideologies. And so yes, you can be a contractor or a subcontractor. What we're looking at is that you will be the designated agency and who's kind of in charge of that participant. Because what we can't do is have multiple different providers claiming for one participant. We have one designated person who's going to be kind of the overarching agency, and then subcontracting with the other folks. Will each provider be required to provide either in-house or by subcontractor all listed services? Yes. That's a fantastic question, and that is exactly what we're saying. Statute has stated that these are the services that are to be provided to the people who are referred. And so if you aren't able to do it yourself, that is the perfect opportunity to start talking with people in your area and making those connections. What do you do really well, and what don't you do, and who in your area can provide that? Get those partnerships going, and the idea is that this will be a starting point for some really comprehensive community resources. This will also be an opportunity for folks to tell us at the state level where the gaps are in service and where the gaps are in workforce. And this will be more evidence and data to support the importance of the fund to not just go for year 1 and 2, but then to be an ongoing process, and that we will hopefully be able to demonstrate that this is an effective way to approach diversion and reentry. And then ideally, we will receive ongoing funding. Have a couple more questions going. Okay. So as this one last person is typing, I do want to just remind you all that we will have more communication coming, and please do remind others that if they should have been getting this information and they're not, to let one of us know, Angie or myself, and we will look into it and make sure that we get the information out there. I also do want to remind you that we have recorded this for today. We will post the link to the webinar. We will provide you with the application. And Angie and I are very excited about this opportunity and so thankful for all of your willingness to take an hour out of your day today to hear about the program and for all of your fantastic questions. Couple more questions here. What is the total amount of funding available statewide? So the first year funding is $10 million. Year 2 funding is $20 million. And so the voucher system, we are looking at really minimal off the top for infrastructure for our voucher system, and the rest is going to treatment. Brandon, do we have to show a formal partnership or referral list for services that we don't provide? So I'm trying to think. Yes. I think is the answer to that. So if you don't provide the service, who's going to provide the service? That would be something that we would be looking for. Will this slideshow be able to be printed off? I think so. It'll be a webinar link, and then yes, we can, if we need, we can just send the PowerPoint out there as well. And are the presentation slides available? Yes, they are. So at this point, it is 1 after 2, so we are going to thank you again for your participation, and we will look forward to emails and phone calls and lots of applications coming our way. All right, thank you all, and have a fantastic day.